Good afternoon. This day marks the beginning of 40 days into the wilderness that we now know as healthcare. It's a cry and a call for those who are voiceless and those who have been marginalized for direction out of the maze that healthcare has become with one simple word: reform.
Feeling that we have that over the past several decades, many millions of Americans have not received the fundamental right of health care that we all deserve. We should not be debating and negotiating over a human life, if someone's life is more precious than another, if someone has an option or not. Many civilized nations are ahead of us in this regard, but we in this greatest country in the world still can do better. We can cover the many millions who are not covered, and we can, yet it is not serving all of our citizens. So we support a reform. We do not know exactly how it will look like right now, but we need to give this reform a chance. We cannot kill it before it comes to being, and we believe that there's a lot of good in the debate that's going on in our country today concerning the healthcare reform. But we call on all sides to restrain themselves, think with the nation's interest at their heart, that this is above politics, this is about the children, it's about the women, the elderly, the human beings that are left behind and forgotten, who cannot afford it, who cannot pay for it. I'm, for one, willing to pay my share and extra to ensure that another human being is living. In the Quran, God says, if you save one life, it is as if you saved all of humanity. And we should all be willing to save a life, one of our countrymen. So, as the debate rages on, we feel the need as faith leaders to stand up and set the record straight that from our point of view, from my point of view, from Islamic point of view, healthcare is needed for everyone, and we should find a way to do it. How? We will leave it to the legislature.
The real issue is the cost. And I think that the Democratic Party is to be given credit for pushing the issue of healthcare reform. But there are some concerns. As Bishop correctly pointed out, the Senate version hasn't yet been formulated fully. I'm just wondering to myself if the House version has been written. We do have great concern for beginning of life issues and for end of life issues. Which brings me to another concern, and that is public funding of abortion. One of the wonderful things about our country has been that the government has always respected conscience. And if an individual or an organization such as the Catholic Church, I'm speaking now as an honorary Catholic bishop, if I step out of line, are we going to coerce Catholic churches under federal mandate to perform abortions? Our obligation is to share our thoughts, and sometimes strongly, not riotously, but strongly with those who govern us, in the hopes that based on our religious traditions of caring, of conscience, of looking out for one another, that the correct health reform will in fact take place.
Lest we think this is relegated to 1,000 pages of paper, I'd like to remind you that 6 people die in Florida every day without the benefit of health care. And it does not affect just arbitrary citizens. We have with us today a citizen of Orlando, a citizen of these United States of America.
My name is Dorothy Buckley, and I'm a member of FOCUS, Federation of Congregations United to Serve. I'm a community leader at the Mount Zion Community Organization. And while I volunteered many hours representing the community in which I live, I'm here once again not only representing others, but pleading for help for myself. After being diagnosed in 2007 with diabetes, my insurance costs went through the roof. I could no longer afford the proper care for myself. I'm sure you've not experienced this, but it's only an addition to a permanent problem. I barely managed to keep up with medications and supplies, but I have managed. In February of 2008, I was diagnosed with breast cancer. After surgery, chemo, radiation, and lots of prayer, I am on the mend. I have one issue that only my elected officials can help me with, and that is coverage for the future. I have searched trying to find insurance coverage, but I'm told the same thing repeatedly. We do not cover pre-existing conditions. It is a disgrace that in this great country of ours, affordable health care for those through no fault of our own have reached a point in our lives where we cannot afford health care. That is why we have invited our members of Congress to join us on our event on August 20th. They have sent us a resounding no. We trusted you. We believed you to be a person of integrity. We believed you kept your word. When we voted to send you to Washington, it was to speak for us, and now you won't speak to us. I ask, no, I beg for help for myself. As you draw the plans for health care reform, I plead with you to etch the face of myself and many others across Florida who need help in this manner. Pre-existing conditions have always been a sticking point with insurance companies, but I don't think that we should be punished or managed without a thought. There are thousands of us being turned down on a daily basis because of this. We deserve the right to grow old gracefully and with dignity. I'm not asking for a handout. I'm asking for a hand up. I ask you to address this issue. I speak on behalf of many others like myself, and I ask you when the time comes that you do the same. Thank you.
Thank you, Dorothy, for putting a face on the issue at hand. During this hour, 2 more people will die who do not have health care. As people of faith, we have an opportunity to be both a healing presence and a voice of justice for those in need. Our stewardship as people of faith constrains us to speak the powerful truth to those who we elected to represent us in a place that can make the greatest difference for all of its citizens, making it affordable, accessible, inclusive, and sustainable. And the land of the free and home of the brave, where there is liberty and justice for all, health care remains a prisoner of access and affordability, and that is the precise concern. I'd like to again reiterate the invitation that Dorothy gave for August 20 at Good Shepherd Catholic Church, 5900 Oleander Drive. We'll create a sacred space where those who have issues and concerns can come and voice them, whether the legislators are there or not. It'll be your opportunity to make your voice heard. And if you don't mind, I'd like to close with prayer. Gracious Creator God, remind us that it's the love we share between us that establishes the need for justice, which fuels us with the power to complete the work you have begun in us, simply because